This past weekend, a clear example that the overdose crisis in Toronto isn't getting the attention it deserves. Both advocates and politicians are agreeing on that, with Toronto Paramedic Services responding to 40 calls related to suspected overdoses between Friday and Saturday. 3 people died. But where is the help which is so urgently needed right now, especially with experts saying that COVID is intensifying drug use?
There is just so much stress now because of the isolation that people are feeling. They don't have the social support because of course, financial stress. Like they might have lost their job or they're having issues with possibly housing.
This past weekend set a disturbing record. Toronto paramedics received 40 calls related to suspected overdoses. It's been a tough few months. Paramedics also responded to 34 calls of fatal suspected overdoses in December. Early data from the Office of the Chief Coroner for Ontario says there were 823 deaths in Toronto last year, which were drug-related. That's 67% higher than the 494 deaths reported in 2019. Overall, fatal suspected overdose calls to paramedics were 90% higher in 2020 than in 2019.
The pandemic, of course, increases that likelihood of undertaking when they're using drugs in a separate or isolated situation, which we really don't want.
They're already kind of in this state where they're under lots of stress and they're, feeling stigmatized because of their drug use. And now we're being told to stay home as well.
This is not a question of morals. This is not a question of compliance with the law. This is a question of health, first and foremost. If you said to yourself, well, has the response provincially, especially from the provincial healthcare system, matched the scale of the tragedy? The answer is no.
We reached out to the Minister of Health's office, and they say Ontario is investing $3.8 billion over the next 10 years to create new services and expand programs. Further adding, they will immediately invest $176 million this year towards critical mental health and addiction support, as well as $31.3 million in funding for up to 21 consumption and treatment services sites in Ontario's key regions. Advocates say drug decriminalization is the first important step.
People are often saying we need to charge them, put them in jail. But the money that has been spent on this kind of war on drugs for the last, as long as we can remember, could probably be better spent in kind of rehabilitation. So providing those services, providing counseling, providing job search help.
Maleeha Sheikh, City News, Toronto.